Hi everybody. So I am almost 3 weeks post-op double mastectomy. Isn't this cool? Kind of nice and flat. And I told my husband, I really like this flatness. Him not so much, but I really like this flatness. It's kind of cool. And I've been freezing since I've had surgery. I know my body is traumatized, but I can't even, I'm sitting in front of a heater right now. I can't even tell you how cold I am all the time. I'm cold on a good day, but having those big jelly-filled fake tits, I think we're insulating, and I don't have a lot of fat. I digress. So I've gotten a lot of comments about how helpful these videos are to many of you. Those of you that have gone through breast cancer or know others that have, or just learning. And so as long as I find them valuable and something comes to mind that is a learning experience for me, I'm going to continue to share as long as I feel like it's important. So thank you for all the comments that you've given me, and for a lot of you, it's causing you to do some self-check. This one friend, she emailed me today, Steffi, she's like, I'm constantly playing with my boobies. Well, I did too, and that's how I found my cyst, and I found it, and the mammogram did not. And most people, my brilliant, I don't have to have radiation now, but when I thought I may, radiology oncologist told me that most people wouldn't have felt that tumor until it was doubled in size. So being neurotic and being so in tune with your body is a perk. So Steffi, keep playing with those boobies, and get your husband to as well, so y'all can compare and contrast. But I wanted to talk today about a couple of things that I have learned. And so, like I said, I'm 3 weeks. I'm very much into movement. The movement has helped this recovery so much. I can't even tell you. The ability to move around and maneuver and up and down and all around without using my arms is crucial and key. So really think about the way that you train. It's almost to the point, though. I went into my recheck today with Dr. Min, and I'm holding my arms overhead. I'm like, hey, look what I can do. And my husband was in there. He said when he saw just this look on his face. So I'm having to be contained, which a lot of people don't have to be contained. But he explained something today. So the process that I'm going through is I had the double mastectomy. They do skin sparing, which I didn't understand. I thought you do a double mastectomy, they cut all your tits off and you're good to go, and then they start building stuff. Well, what they do is they take all the breast tissue out, they save the skin, assuming you're having, this is for reconstruction, and maybe they do that for even some of these other procedures for reconstruction. And then they put the expanders in under the skin, and they do that to try to keep the skin alive so that there's still blood flow in it and they can use it once they put implants in. And I didn't realize that part. Then I learned today my ribs are super sore to touch. These expanders are so uncomfortable. I feel a constant burn. Maybe that's the way I'll explain it, but just constantly uncomfortable in my chest because the expanders have a harder backing. They're soft in the front, so you can see they move around. And they've got a little bit of liquid in them, but they've got this hard backing against your chest wall. And then they put, I'm going to call it cadaver skin, but they fortify the chest wall under the expander. And then there's one long suture. So that's why Dr. Min about shit his pants when I'm moving my arms around. He said there's one long suture that holds that all in place. My surgeon created a pocket. You want that pocket to stay set so that the Dr. Min, the plastic surgeon, can go in and do his magic. But right now there's one suture holding it all in place. So that's why it's so important not to move. Like, they don't even want me walking. I got released today to be able to walk 30 minutes. So you know how challenging it is when all normalcy of your life is stripped away. And as you know, those of you that follow me regularly, I am not filtered, and I am not going to be filtered, and I'm not going to walk on eggshells, and I'm going to talk about the things that nobody else is willing to talk about or that they don't know. And when I am met with, at least you have the most curable cancer, At least fill in the blank. Do you know how demeaning and condescending that phrase is? So I would love to caution anybody watching. There's another way to show up and say things that can be uplifting and encouraging and stay realistic. Because when you've been diagnosed with cancer, it will forever now take up bandwidth in my head. Doesn't matter, my friends, that was 10 years ago. I've been good. Yeah. And you know what? There's still a little C up here somewhere because I feel like I've been branded, if you will. A friend of mine sent me the most profound note I have gotten to date. And part of it was she lost her husband 4 years ago to cancer. And I woke up to it this morning, and I want to read this quote that she said. To me, it summarizes getting diagnosed with cancer. I don't care if it's the most curable or the most aggressive. It sucks, and it sucks dick. Big, nasty dick. And the quote is this. She said, first of all, she said, "I'm sorry this is forced on you." And that was very thought-provoking. Cancer is forced on us to address it and deal with it. And yes, there's a lot of lessons in that I would probably not choose to learn. But I am, and I'm going to do it with 150%. But knowing that, this is the quote. She said, "It's the theft of one's peace of mind that I find the greatest violation that cancer inflicts on the patient's lives, as well as those that are family and caregivers." I love that quote, Christine, so thank you for sending it to me, and it's true. And so, yes, some days it's like, it's okay, it's no big deal, and I know others have felt like that, but the fact is the violation of peace of mind, because I will forever now have this stamp of cancer. And there are protocols to do it, and I'm throwing all these different things at it, like I've mentioned the IV therapy. I found out last week, and I've been told this whole journey that it's stage 1, it's grade 1, which means slow growing. And chances are, if I do a double mastectomy, I won't need radiation because I was going back and forth at the beginning, and I most likely, it would be very rare chance that I would have to have chemo. Another thing I'm learning about cancer, it has the last laugh. So my pathology came back from my double mastectomy, and part of it is grade 2. Grade 1, no chemo. Grade 2, possible chemo. Grade 3, absolute chemo. So I'm in the gray area now. So I meet with my medical oncologist, not my naturopath oncologist, but my medical oncologist on Thursday to see what next steps are around chemotherapy. And here's what that means. That means that if I have to have chemotherapy, then that will prolong the reconstruction, which prolongs moving towards my normal life that I've had known for many years. So it's such a clusterfuck and a mindfuck, y'all. And I have good days and I have not so good days. And I'm going to keep posting these things about the mental game that cancer brings into our lives, as those with diagnoses and those that are around us, because I'm really seeing how hard it is on my husband and men especially, who are easier to compartmentalize. And Chris said this at the end too. She was like, please be gracious with your caregiver. And because she was the caregiver with her husband, because they are having to process things that I'm having to process. It's not in their body, but yet they're out of control of it. Not that I have control, but they're very out of control. So I really didn't talk about what I came on to talk about. I just let it follow where it needed to. This is a little longer. Continue to reach out with any questions. Keep playing with your titties. Get an ultrasound, because mine wasn't caught on mammogram. Do all the healthy things that you can do that are in your control, and keep moving well. The next video I do, I want to talk about some best practices that have really been helpful to me that no one told me about. Some people did, but some other things I've learned on my own that I want to share with you. So eat your whole foods, hydrate, get in the sauna, move every single day for at least 30 minutes, and have faith. Like, have faith. And I hope that you are finding peace and joy and some big laughter in your day. And I'm here with my babies. They bring me joy as well as my loved ones and y'all.